Hi everyone, welcome to Girl Talk. This is your host, as usual, Andy Patenia Matthew. Now, our last episode celebrated June being Pride Month. And for today, I have a revelation for all of you. I am not straight. Well, my body isn't. And you will find out why when we return here on Girl Talk. Welcome back to Girl Talk. Now, the reason for that revelation, well, it isn't actually a secret. It's more of a declaration. The reason why I'm telling you this is because there's actually one more thing that we're celebrating for the month of June, and that is Scoliosis Awareness Month. And I hate to say this, but your girl is scoliotic. So there you go. But the thing is, I have never really had the chance to look at my condition straight in the eye, meaning I did not really do anything significant in terms of dealing with this condition that I've had for, I guess, the past 20 years already, which is something that you should not follow. So this is actually not a good example. But before I introduce to you our medical experts who will be telling you about this condition, its causes, symptoms, treatments, let me first bore you with my backstory, and literally my backstory. Okay, so for the next 10 minutes or so, you will be seeing nothing but my face, and I apologize for that in advance. So here's my story. So I have found out that I have scoliosis when I was in grade school, I think. I could not remember exactly what age or what year it was. However, one vivid memory that comes into my mind is an incident wherein we were attending Mass and the church was very full at that time, so we were standing outside at the back. And one relative pointed out that my back wasn't straight. Ingon siya, hiwi daw akong likod. And then that relative told my parents. And then we had 1 or 2 doctor appointments, and it was confirmed that I had scoliosis. But at that time, it wasn't as bad as it is right now. So my curvature was not that worse back then. And then my doctors just told me to do some exercises to help prevent my curvature from becoming worse. And at the same time, they also recommended that I wore a brace. But me, being my stubborn self, I refused to wear one at that time because there were so many things that I wanted to do, and I did not want my physical activities to be limited because I had to wear a brace. And I think if I had done otherwise, my curvature wouldn't be as bad as it is already. So there you go. I was physically active in the performing arts. When I was in college, I joined the soccer baseball team despite my scoliosis. And then my memory now brings me to a scenario during the late years of my college years. I remember I woke up, I think I slept in a bad position for a long period of time. And then when I woke up, I was in excruciating pain. So my back was very, very painful. I could not move at all. So I had to scream for help. I had to ask my brother to lift me so that I could stand up because di gid ko kalihok because sakit gid kaya akong likod. And then they rushed me to the hospital. And when we got to the hospital, the nurses and the medical team had to put some heat packs on my back to alleviate the pain. And then nasad sila gipang taod nga mga cords that would send electric signals, but it was the good kind of electric current that helped me manage the pain at that time. And then I had an x-ray, and then the doctor had to book me for a few more therapy sessions just to help manage my condition. And then, when things got better, you know, sakit sa Pinoy, I did not see my doctor again. I've learned to live with this condition up until today. It's been a long time since I've owned it and I've accepted it already. And I have frequent back pains, But murag, it came to a point wherein naanad na lang ko sa ako ang sakit sa likod. And aside from the frequent back pains, I guess one of the things that I've also come to be used to being a scoliotic individual is that I've learned to discover my angles, okay? So what I have is dextroscoliosis of the dorsal spine, which means that my curvature is towards the right. So as you can see, and if you may have noticed in all of the tapings on Girl Talk, I always take the left side because my angle is on the left. So as you can see, there are two sides of my body, one sexy side, or I choose to believe so, and one fat side where the bulge is. So my left side is where you can actually see the curve. So this is why I always position myself towards the left angle, because this is where I have a curve. However, when I tilt towards the right, if I emphasize my right part, there is no curve at all, and there what you can actually see is a bulge. So this is my unflattering side, my right side. So if you are my friend and we take a photo together, please do understand that I will always take dibs on the left side of the angle. Because again, diri man good ang ako ang flattering side. And then what else? I always stand on one foot. Most of the time, I do it unconsciously, but when I notice that I'm already standing on one foot, I always try to make it a point that I'm balance my weight on both legs. What else? My shoulders are uneven, and again, there is really a significant bulge on my right shoulder and right back. And then I think the major significant comment that has really impacted my life on my condition is that people have always been telling me back then that if you're scoliotic and you're a woman, you will not be able to get pregnant. So those comments on how crooked my body looks didn't bother me that much back then, because I came to own and accept that I am scoliotic. However, when people come and tell me that I won't be able to give birth, or I won't be able to be pregnant because I am scoliotic, that kind of gave me anxiety when I was younger. And I would admit that it also plays a big factor to why I chose to have kids in my 20s, because I was scared of what they were saying to me back then. So if you know a woman who has scoliosis, please do not give these kinds of comments or advice which is not really backed up by medical facts, because you will be causing unnecessary anxiety towards that individual. So part of this episode will be clarifying the facts around scoliosis, fertility, pregnancy, and childbirth. And we will be asking our doctors about the truth behind this. But if I may share, I now have two beautiful children, and I am a living proof that even if you are scoliotic, if you're a woman and you're scoliotic, you can still have kids. However, probably my scoliosis played a big role to my excruciating labor experience, because when I had my first labor for 20 hours, I had extreme abdominal and back pain at that time, and probably naka-play gyud og big role ang akong pagka-scoliotic ato nga time. So later, we will be asking our doctors if scoliosis can actually cause painful labor experiences for scoliotic pregnant women. So there you have it. That has been my literal backstory. And when we return here on Girl Talk, we will now be having Orthopedic Doctor Dr. Judith Akol and Rehab Doctor Dr. Elda Anota to tell us about what scoliosis really is. So please don't go away. Welcome back to Girl Talk, and now finally we have medical experts with us in the studio to shed some light on what scoliosis really is. So I'd like to welcome Dr. Judith Akol. She is an orthopedic doctor, and we also have Dr. Elda Anota, a rehab doctor. They're both from Chonghua Medical. Docs, good day
Hello.
to the both
Good morning.
of you.
Good morning. Good morning.
Daghan kaayong salamat for being here and for taking the time out of your busy schedules. I know nga daghan gyud kaay mong mga appointments, but you accepted our invitation to help spread the awareness on what scoliosis really is. So let's start by answering the simple question, Doc. What is scoliosis and what are the different types of scoliosis?
Okay, so when we think about scoliosis, I'll make it the simplest way.
Yes.
The simplified way of describing scoliosis is if you imagine your spine, so the spine is straight. Okay, if you look at all the images of the spine, it's straight. So if you do an x-ray or any deviation, it just curves a little bit to the right or to the left. That is already defined as scoliosis. So it may be so mild that it's maybe 2 or even 5 degrees. That is very mild scoliosis. Or it can be more severe wherein you see visibly from looking at a person's back that parang siyang S na ano. So there are, and maybe the majority of scoliosis is known as idiopathic scoliosis.
What does that
what is
mean?
idiopathic scoliosis? It just, you have no clear-cut explanation as to why there is that scoliosis. But there would be a small portion wherein it's neuromuscular, meaning it is actually associated with other problems like inborn, so or some congenital problems, or maybe even some problems in the formation of the bone. That's why one of the initial things you do, especially for children who may have scoliosis, would be to get an x-ray, because you want to rule out some of those problems where maybe you can correct bone deformities or you have to do other workups. But for the idiopathic scoliosis, they usually are more mild.
Okay.
And we don't really, it is not, I just want to clarify that misconception that scoliosis is equal to surgery immediately. Even if as a surgeon we discuss it, it doesn't mean that we operate on everyone who has scoliosis.
Yes.
Okay. So the question there is, how do you know? I think that some people will say, uso naman ang scoliosis, or it becomes trending like scoliosis. How do I know I have scoliosis?
Yes.
For some,
What are the symptoms,
yeah,
Doc?
for some you will notice it can be visible already, especially for teenagers, that they would look at their shoulders, it's not equal. So it's like one is higher, hiwi gamay. So mas taas ang one side, or part of the back you will already see na curve gamay.
And then there's a bulge.
Or there's a bulge in one part that some people will get scared na basi na nitubo kaya nagbulge na nagtumor or mga inana. But actually, it's because your spine has curved, and the entire, you think of your spine with the ribs. So if the spine curves, the entire rib cage also twists a little.
Mukuyog siya.
Yeah, so if it twists, one part will go higher. That is the one that's causing that hump looking in the back.
At the back.
Yeah. So these are when they are already visible.
Okay.
For a majority, it is an incidental finding, especially for those who get
Chest x-rays.
chest x-rays. So they do a chest
For
x-ray
work requirements.
Yes. And then when they do a chest x-ray, they will see the official reading na scoliosis, and then nag-uul na sila because they will not get immediately cleared. But actually, it is asymptomatic. Sometimes it may also just be your posture, your positioning. So we will opt to observe these cases.
Doc, I just had my x-ray. This is my latest x-ray in April. And the finding says that I have dextroscoliosis of the dorsal spine. So, unsa may pasabot aning dextroscoliosis?
Okay. Dextro, okay, by the term Latin and all that, is that it just means right. It's right-sided. Levo if it's left-sided. So it just is, in a way, a description for the radiologist, for the other doctors to understand the description as to the direction of the scoliosis or the side where it is curved.
So that's
to.
dextroscoliosis. The curvature is towards the right.
Towards the right side.
Ang sa left is called
levoscoliosis.
Levoscoliosis. Kaning dorsal spine, Doc, what does that mean?
I'm not so sure why they said dorsal spine, but it usually will tell you which part of the spine, if it is the cervical spine in the upper, in the middle part, if it's the thoracic spine, the lumbar, or usually it's in the thoracic or thoracolumbar area. And then when I mentioned earlier, diba, that when it's relatively early, you don't really have, maybe you may not have to do this, but the question for some people will be, unsa naman yung brace, di ba? Pwede ipa-brace, ana. So, that's when if we see them from ortho and we tell them the option of bracing, di ba? Kasi remember, it's curved. The only purpose we want is that it will not worsen.
So, di siya makapa-straight ang brace,
Dili man. So, we will refer to our friends in rehab to do the bracing or whatever things they have to do pa.
Okay.
So, the best person to explain that would be Dr. Anota.
Best talaga.
Pero Doc, before we go to the treatment part, I'd just like to ask for our viewers to know, sa causes, bali Doc, is it genetic? Is it something that you're born with? Because personally, in my family, I have, I think, 2 cousins who are also scoliotic, and they've had their surgery in the US because they migrated there. In my case also, Doc, just to give you like a medical history of myself, when I was in my childhood years, I've had JRA. So I had juvenile rheumatoid arthritis. So for everyone, more siya grayuma para sa mga bata, right? Para masabtan sa kadaghanan. And my mom tells me that it might have also played a role in my scoliosis. Is that true? Or
It may, but it's not all, the fact that it is called idiopathic scoliosis it's the easiest way to explain. We don't really know. It's a nice term to say we don't know. Okay, so it's idiopathic.
So it just happens.
It just happens. It's not really genetic that you can prove if a gene associated with it. But there is a tendency if you start tracing relatives or a family tree, there may be a risk, but it does not follow that if you have scoliosis, your children will have scoliosis.
But it's not also caused by something that you've done physically.
No, it's not something na you've done. The only thing that might be associated with maybe being, let's say, you're saying, are you born with it or something like that, is if your scoliosis is congenital or something that is associated with a structural problem, something that there was a problem in the development of your spine that caused it to curve. Then then you can find that exact cause. But if you can rule that out, that there is no exact cause for it to curve,
that's when it's called idiopathic.
That's when it's called idiopathic. And the majority of patients with scoliosis are idiopathic.
But it cannot also be caused by an accident, Doc.
It can be only caused by an accident if the accident did something to the bones of your spine that caused it to curve.
Okay, but this one is rare.
It's not common, yes.
Okay. So, arita sa treatment.
Nakita sa initial.
Yes,
Sige.
initial treatment.
Sige, baka from what I said, Dr. Anota has something to add ba?
Add something.
Yes, because that's the same thing that was recommended to me when I was in grade school. They told me to wear a brace, but gahi kog ulo ato sa Doc.
Daghana mo.
Yeah, which again, earlier explained to the viewers nga, dapat wag tularan. Because I felt at the time that the brace would limit my physical movements, and I was so into performing arts, sports, so I was stubborn at that time, and this is what happened now.
Patient education is very important. So,
Yes, Doc.
idiopathic scoliosis, the most common is in thoracic area. No? But there is a scoliosis which is not idiopathic, which is caused by a longer leg or a shorter leg. And it will affect the lumbar spine. So
dili even, Doc? Di
Dili
pantay?
even. Taas ang usa ka tiil, mas mubo ang usa ka tiil. Nya pag tubo nila kalit, na scoliosis nga ma-form sa lumbar spine, dili ang thoracic. Katong
So,
thoracic
ubos
sa
na ang
dimension ni
lumbar
Dr.
spine, Doc?
Yes. So that will affect the lower, tapos mugukod na lang ang upper.
Okay.
No, ang idiopathic is thoracic yun, walay rason. So ayaw pag blame imong mama, imong papa, kay wala lagi rason, no? So onya ikaw sad mother, do not blame yourself.
Don't feel guilty.
Don't feel guilty. Kay dili na imuhang
Sala.
Sala. So ana. And then let's go to the brace. Indeed, the brace, if you maingon sila, gi-brace man gud ko nimo, mo na nga di nako kalihok. Siyempre you put a brace because you want to limit something, di ba? So in this case, kung scoliosis, you want to limit the further progression of the curve, di ba?
Yeah.
Okay. So, during your time when you were very, very young, the only option during that time was only katong rigid brace. So,
Okay.
rigid brace, indeed, if you will ask a child to wear a rigid brace, dili sila ganahan. Why? Dili mag-dancing, mag-sports, di ba? Ingna kuno ang bata dili maglihok, no? So,
Di ba?
We are even kanang happier if the child is
Active.
active, wala naglihok na sa kilid, di ba? So we encourage the children to be very, very kanang mo active, no? So lisod yun na when you hatulan nimo tagaan nimo brace, but during this time there is what you call dynamic brace. So,
What is that, Doc?
Spine core. No, we have that. You have to. The public has to know that there is a dynamic brace. It's no longer the rigid brace. This is a brace which is composed by 4 straps. No, so we have to classify the patients with scoliosis. It has been in the market for several years already.
Okay.
And Dr. Byron Garcia and Dr. Mary Jean Flordelis and myself, Dr. Anota, we are here in Cebu to help these patients. So we have to. It's a dynamic brace. We have to classify what type of scoliosis. We have to talk with people in Indonesia and in the UK, and we have to agree with regards to the classification, and we have to prescribe it. So not all scoliosis patient will have the same type of spine core.
So this is customized.
Customized
According to the curvature of the spine of the
and
patient.
your measurements.
But is
So
this
you can-
less does it have less discomfort compared to the old
Yeah,
kind
there
of
is
brace?
discomfort because, for example, an elastic strap will make your spine like this, will pull your spine like that, no? So nag-ana nakakaron. So however, we can always adjust, no? So initially there are pressure points. Initially there is a pain because your spine is pushed like that. But later you can adjust to that, adapt to that.
Until eventually your posture will be that way without the brace.
Yes, but that's not the only option. The other option will be knowing what exercises to do. So the exercises, there are different types of exercise. I don't want to give specific exercise for a specific problem. Kung mild scoliosis, as Dr. Akol has told you, it can just be postural exercises only. Or
How about swimming, Doc?
The most important thing is to have a diagnosis. So go to the doctor.
Di magbuot-buot.
Get a diagnosis. Talk with your doctor unsa gyud nga klaseng scoliosis, scoliotic ba ka or dili? Because ang uban moingon nga scoliotic gyud kuno sila. Nya pagtanaw nato dili man gyud siya scoliotic, kay nag-exercise lang natulid naman ang spine, no? So swimming is one of the exercises is encouraged because it's non-weight bearing. And na-stroke nga padungan na-stroke padung ri, di ba? Kay di man ka pwede usara ka side.
Wag na.
Naadiri, di ba? So we just have to give them, discuss with them the appropriate exercise for their particular scoliosis. The exercises will be composed of mga stretching exercises. There should be stretching. There should be an exercise directed towards the curve. No? There is always an apex of the curve. We have to look it up in the x-ray. And then there is also strengthening exercises. And patient education is very important. How to take care of your back. Okay.
In my case, Doc, ang pain usually happens when I come from a very strenuous activity or ang pinakasakit ko, Doc, no, is when I sleep for a long time in one position. Then when I wake up, as in sakit siya kaya akong likod, and there was even a time when I had to be rushed to the ER because I could not move. Yes, because that was the first episode manggod. So I screamed for help, yato ko sa ER, and then nato sila gipang butang ang heat packs. And then nasa sila gipang butang ang electrical cords nga mukurinti sa akong back, and it felt really good. I had it for like 5 sessions.
So, just to clarify, scoliosis will not cause pain.
Yeah.
Okay, it's just that because you have this curvature in the spine and you have this imbalance with how your muscles are acting, it is now parang laying down the tendency for muscle spasm. So you have, so the one that causes your pain generator is the muscle spasm. So sometimes I know I get patients like that na I was sleeping for a long time and then I get pain. But sometimes you say you have to think about it. Even if you didn't have scoliosis, you might still get that pain.
Yeah.
But it's
I'm a stiff-
because of the muscle spasm. It's not the scoliosis that caused the pain.
Agree.
But the position may be that encourage possible muscle spasm in that area.
Okay.
But I
so
have an issue that I
Oo.
want to, since ako rin mag-ask, no.
Sige, may ask.
But kay Dr.
Go ahead,
Anota, because a lot of people will now say, di ba, you do exercises, but
yeah.
there's a trend of people saying na they'll do yoga, and with yoga, personally, I would encourage yoga for back pain.
Okay.
So, it's the same for scoliosis because it does lessen that spasm and improve your core.
Yeah.
But the question of some people would be, would yoga improve or correct scoliosis?
Okay, so yoga is a combination. These are poses, di ba?
Yeah, and stretching.
Na mga poses sa yoga. And you cannot do anything about it because they declare that this particular pose is like that, no? So, it's a combination. In any pose, there is a combination of stretching and strengthening. You stretch a particular group of muscles, and you strengthen a particular group with that particular pose, no? So, ang general rule is that if there is so much pain, no, acute pain, you should not be strengthening that muscle. So, himay-himayin mo na ngayon kung this particular muscle should not be strengthened kasi masakit siya. So, ayaw pagbugsa. So, we will not be there to advise you na dili na pwede nga pose, no?
So you have to listen to your body, Doc.
Listen to your body, that's right. That's perfect, no? Listen to your body. If it increases your pain, you are not doing the right thing. No, ana lang. Then if it increases the pain in anything you do every day, you go see your doctor. Huh? Because we cannot continue having pain because pain can be forever in our lives if we don't deal with it.
But what are the physical activities that you would advise scoliotic patients to avoid if para dili na magsakit ilang likod or mo further curve ang ilang
Like
spine?
any other person, we have to avoid trunk bending, no?
What does that mean,
That
Doc?
is trunk bending, that is improper body mechanics when we pick up something from the floor, be it with load or no load, no? When we pick up something, we bend. Basta na punit, ana ragyo dili. We have to observe proper body mechanics. That's one, no?
So you have to bend your knees.
Yeah, you have to bend your knees to reach out something
Yeah.
below your waist level. Ang number 2, you have to know how to stretch your muscles. A muscle that is stretched is relaxed, no? So, different types of muscle, different types of stretching techniques, no? And you have to strengthen your muscles so that your muscles are always ready for the demands of your day. Okay, so these are the general things. So.
But you can still be physically active if you're
Yes,
scoliotic.
even
Doc.
if you're
You can still engage in sports, in
Yes,
martial
yes.
arts, gymnastics.
Yes.
Scoliosis is not something that should limit you. And just to clarify and correct, you cannot use all these exercises to have a scoliotic spine, so something that is bent becomes straight. All of these mechanics, putting brace or exercises, will just manage the pain and prevent worsening.
Yeah.
But it is not something that will correct.
Correct the spine.
Yeah.
But you should do something every day so
Yeah.
that you will erase the what ifs in your life. What if I did exercise regularly? What if I did this? I might dili na tingay ko na operahan. Ana gani. Oh. So ang uban man god sige exercise pero na operahan at the end because the scoliosis still continued to progress. Ana.
Even if you're not a growing individual anymore,
No,
wala ka nagtubo.
that's a different story. So we are talking about the growing individual.
That's why you follow up more closely for growing, because during
At what
the
age,
growth
Doc?
so until the growth spurt.
So that is around
for children, let's say for women, the growth spurt is a little bit earlier, 'di ba? Until when you get your menses. That's when you sort of end with your growth spurt. So until around 14, 15. The boys, the growth spurt will be until maybe they're 16, 17. So we observe progression of the scoliosis during the growth spurt. Now, the higher the curve is, so that's why we measure the curve on the
Yes.
x-ray, is the faster exponential ang growth, ang curve progression. So if it's really very mild, even if there's a growth spurt, it doesn't really make a difference. But if it gets to that magic number, let's say it's already 40 degrees,
55,
diba? 40, 45
Klaro na
degrees.
gid kay na doc na.
Klaro na gid kayo.
So mga 40, 45 degrees, kahit na wala ng growth spurt, it will still progress. It's because of the mechanics. It's
Okay, nag-ana na siya, nag-bend na siya.
nakabend na. So you think of it like a building.
Yeah.
If the mechanics of the engineer for the building is not correct, it will get problems as you go along in the future. So ganun lang din the way you would look at the spine.
Okay. Thank you, Kayo, Docs.
Yeah.
When we return here on Girl Talk, we will be asking a few sample exercises
Sure.
from Doc Elda. And at the same time, we will discuss in detail spinal surgery, the costs possibly, and of course, the different myths and facts surrounding scoliosis. So don't go away. And you're still watching Girl Talk for our Scoliosis Awareness Month episode. And this time, mag-zumba me, joke lang. We are still with Dr. Elda, and she will be teaching me basic exercises for my condition, which is dextroscoliosis. So my curvature is leaning towards the right. So Doc, what
Yes.
should I do? What are the exercises and movements that you would like to recommend for a patient like me?
Thank you, Andrea, that we will make your back an example.
Yeah, sige, matalikod ko.
Yan. Okay, so we usually divide the hair in the middle, and this is where scoliosis is, no? So there is a lateral curvature of the spine. Maingani kag to the right ang facing sa curve, no? That's the convex side. So
Yeah.
that's dextroscoliosis. So kung dextroscoliosis nag-ana yang spine. So imong exercise to the left, to the right,
To the right,
So,
to the-
padung ka ana.
Unsa ba na kung bato,
Ana
Doc?
ka mo stretch ka padung adto. No,
Okay.
that's one thing that you can do to the right. Okay. But
For how
sige,
long, Doc?
pwede na ka mo harap. So if you want to, if you stretch, you improve the flexibility of a muscle. No? So the muscles near your spine are oriented vertically.
Okay.
So if you stretch towards the right, you are
Yeah.
stretching. If you bend towards the right, you are stretching the left side. So
yeah.
balik ta sa likod. Okay. So kung moana ka sa right, kay remember kani ang mga tight muscles sa left side.
Yeah.
Kaya ang right nimo nag-ana man, no? So mas-stretch nimo ang left side. Okay, so pwede na nimo buhaton nga habit. Oo.
For how many times,
Actually,
Doc?
ningon sila, the longer the better. But there are other stretching techniques which you can see in the YouTube, ana-ana, no? But pwede na sad manghiwatid ra ka. Manghiwatid is just like that. Mo ana ka.
Kanang bagong
Imong i-contract imong muscles dire to stretch like that. Yung ginhawag laom during the hiwatid, onya slowly relax it. Relax. Okay. So if you're relax, ganyan. Ana. So if your pain is over here, imo na siyang i-contract at the same time mo ana ka, onya slowly relax.
So you
Okay.
do this every day, Doc?
Okay, yes, you do that several times a day. You can even stretch every hour.
Ah.
Oh, yeah. So remember, in scoliosis, you have a lateral curvature and rotation of the spine. So you can rotate.
So
you
if
can
not-
have exercises nga mo rotate.
So if natay viewers, Doc, na towards the left ilang curvature, balisad ilang buhaton.
Balisad ilang ibuhaton.
Okay. So katong
don't
rotation.
forget the contraction of the muscle and then the stretching. Pwede nimo isa ka imong kamot ana, no? Ang rotation is rotation like
How
that.
do I do
Okay.
that, Doc?
So talikod. So rotate ka to the right. Sige, rotate like that. Okay? So ayaw ni siya pag i-appeal. Sige, go. Girl, kaya mo yan. Like that. So rotation, mo rotate. Yan, rotate. Ngari pa dong, ana. Sige, ay pag-apilan eh.
So dapat
Rotate.
steady, oh my gosh.
No, rotate to the
Like
like that. Okay, so sige lang, first time. Okay, nya relax, hinay-hinay. Okay? So did you feel something?
Yeah.
Murag na-relieve ka?
Yeah, it
Okay.
feels good actually.
Yes. Okay, your pain, sige, pwede na ka mo front. Ako na yung host. Ano ba yan? Sorry.
Go ahead, Doc.
So if you stretch a muscle, that is improving the blood supply to the muscle, thereby relieving the pain. Katong naabot ka sa ER because you had severe muscle spasm. Severe muscle spasm is opposite the relaxed muscle. Nag-spasm ang muscle, decreased blood supply equals pain. So the moment you move your body, nga nag-spasm man imong mga muscles sa likod, your muscles in the back are in spasm, there is so much pain. That's why ni panic ka.
Yeah.
But pwede ra
Abi
gyud
ako
siya.
na-paralyzed
Oo,
ako.
pwede ra gyud siya nga wala siya nilihok until na wagtang ang muscle spasm. But you can also apply cold compress or hot
Yeah.
compress during that time nga nag-spasm. You can also take medications. No, these are the things that has to be discussed with your doctor. And don't forget the neck also, because the
Unsaon man?
back is connected to your neck muscle.
Okay.
So sometimes nag-ana na ta kasi matag-ana.
Sige, cellphone.
Cellphone. So you can do chin tuck positions. Yan, ganyan. Feel ka sa stretch sa imong
Yeah,
neck, no?
yeah.
Chin tuck, ipagawas imong double chin bisag wala.
Na-adjo, Doc. Triple na ganit.
So ipagawas ang double chin, so you can feel the stretch here, no? And you can even stretch like that. Sige, go. Face front, face down a little bit, yeah, down pag yun. You can, pwede sa nimo ana, my dear, ana, pwede nimo birahon gamay lang. Do not be ballistic. Okay, ana. Okay, pwede sad ka mo hangad. Ana sa nag-ana na ka, no? Hangad sa dito sa taas.
Okay.
Okay, para ma-stretch ang other muscles. Like
bitaw.
that. Naka-feel ka sa stretch?
Yeah.
Okay, kanina lang ang nahibawan sa atong neck. Sige lang, tag-ana-ana ba?
Tinuod,
Ano lang tapirni. So you can do that one. Chin tuck position.
How about ka ng pag-lift o heavy objects, Doc? Is that, people tell me nga, uy, ayaw na siya palsaha kay scoliotic siya. Is that true? Nga you should avoid that?
I will not allow my patients, nga young individuals, na pa'y plano mag-travel, hindi na yun ka mag-lift. You become a mother of a toddler,
Yeah.
buntis pa diri, sakit. So, I will not allow them to not enjoy life. No? So, enjoy life good. You can still lift. Yeah, you can do your exercises so that you will be much stronger and you are ready for any tasks of the day or any activity that you want to do, need to do, and want to do. So when you pick up something from the floor, ayaw pagtuwa dito,
Yeah, you
because
always
that
have to
will
bend your knees.
Daghag pasyente si Dr. Akol ana.
Kaya nakalitan og bangon.
Yes, pag ana,
Awani.
ni ana ang likod. So
Agay.
ana na maglakaw.
Thank you, Kaya, Doc Elda.
And you can also contract your muscles here
How
every
man?
now and then.
Magka-absad ko ani, Doc.
Yeah, I am contracting my muscles now in the abdomen. No? It may not
Okay.
be small muscle or small abdomen. No? Pwede man kusgan imong core bisag na kay bilbil. No?
Murnajod.
So kuha na siya kanang i-contract nimo ang muscles
Usaon
dire.
man, Doc?
At the same
I-tighten
time,
nimo.
sige kong storya. Pero I'm tightening the muscles here. Make that a habit.
That improves your posture?
That will improve the strength here and support of your spine. So you do not hold your breath, but nag-contract imong muscles. You can make that a habit. Nag-contract imong muscle, contract
yeah.
your muscle.
And then you keep
sige
on
kong storya.
talking.
Yeah, pwede ra.
But it's kind of hard work,
Yeah,
but
hard
eventually,
work. Yes,
I
because
will get used to this.
you just started man. So but you can make it a habit. Contract this one para dili siya nag-ana ra permi.
Yeah.
Contract para naa siya support. Okay?
Pwede na ako mag-beauty queen.
Yeah, mag-ana ka.
Thank you,
Pwede
Kaya.
sad nga chest out, no?
Like this.
Chest every now and then i-chest out ni mo na. Okay, yeah, squeeze your muscle in the back o yeah, slowly relax it. Yeah.
Sige, ako ni
these are the few
the basic
exercises.
exercises. Thank you so much, Doc
You're welcome.
Elda. And atong balikon, ato invite again si Doc Judith in
Yes,
the studio because again, nasa ko yung mga panghutana about the different myths surrounding
Yes.
scoliosis. Welcome back, Doc Judith. And this time, salamat kay Doc ha for the rehab
welcome.
exercises tips. This time, Doc, we will be talking about spinal fusion surgery. When would you say that it's already really necessary for a scoliotic patient to get the surgery, and what happens during the surgery, and what are the risks that
Okay,
this
that's a loaded question. So, when we talk about surgery, remember when we see a patient with scoliosis, it's not automatic that you will be offered surgery when you're first seen by an orthopedic surgeon, unless it's really severe or you have functional problems already that you cannot breathe or things like that. So,
Okay.
for very mild scoliosis, you will be offered initially with treatment, like say conservative treatment, going to rehab, observing it first, especially if you have no symptoms, managing your pain. And then, well, initially, we have to monitor it with repeat x-rays because we want to see, it's not because we don't believe the first x-ray, but we have to see the progression. How fast is it progressing? Is it progressing like in the from the first X-ray to the next one in 6 months? Did it progress at 1 degree per month or 5 degrees per month? At what rate? Kasi it may have progressed from this X-ray to the next X-ray, but it only increased by 2 degrees. It's not significant compared to someone who's probably 14 years old, still in their growth spurt, and it progressed 10 degrees in, let's say, 6 months.
Yeah.
That's significant, diba? So, we have to do something about it. Now, the treatment is always just there to prevent it from getting worse. So, the external brace, although it can help, and cumbersome nga lang, it's very uncomfortable for the patient. So, the question there is if they comply, if they actually use it.
Yeah.
But its intention is just to hold sort of your spine in place so it doesn't get worse.
Yeah.
Now, if that doesn't work, you think of surgery as an internal brace, something that will hold it in place. So, since you're there na, you're trying to stop it from moving, a little bit of correction is also done. It will not make a curved spine straight. It may lessen the curvature so it doesn't become so difficult, it doesn't progress. So maybe something that is 45 degrees can become 30 degrees or 25 after the surgery. That's why some people might say they get taller after surgery.
Yeah.
Because it's curved. So when you straighten it a little, you gain a little bit of height. But we also don't want to make people taller with this kind of surgery. Kasi as you are straightening it, think of that you're looking at the correction on the bone. Think of the nerve, your spinal cord, which is inside. So when you stretch it, you can't stretch it so much because it might not be amenable to that much stretching. So we don't want, let's say, the risk of having paralysis in the lower spine. That's actually why a lot of people are scared when they talk about spine surgery.
Including me.
They think that spine surgery is equal to paralysis after, or di na sila makalakaw, or matamaan ang spinal cord.
Is that possible, Doc?
It is a risk, but it is something that we at this point in time with all the technology already have found a lot of ways to prevent this from happening. Let's say, well, I am personally not a spine surgeon. I have to give that disclosure. I'm an orthopedic surgeon, but I'm not a spine surgeon. My colleagues who do spine surgery actually do that they attach leads that they already monitor your nerve, that you're not overstretching the spine. So there are that's why a lot of imaging that is needed. They also use computer navigation already. So computers are used to sort of help you for accuracy in the surgery. So a lot of development has happened, and these are things that can be done already. But just remember that not everyone who has scoliosis needs surgery. You will be evaluated if you truly need surgery. And all these risks will be given to you.
These things that you've been mentioning, the advancement in our technology in terms of dealing with spine surgeries, Doc, they sound expensive.
Well, like everything that with development, there is an equivalent cost.
Yeah.
I honestly cannot give you a ballpark figure for this. It's probably something because it might turn people off and think it's expensive. Huwag na lang. It's something that probably, if you are a candidate for this, it is best to discuss it with a doctor already.
And then probably the doctor can point you out to different charity organizations.
But remember that all of this is available in Cebu. You don't have to go overseas.
Because there's always this kind of joke also among people who have scoliosis. They say, Doc, nga, sakit ni sa mga dato. Because it can be expensive. Like, for the brace in particular lang, Doc, what is the range of the brace for scoliotic patients now? What's the price range?
Katong spine core. Okay, so there is a range. I think it's between 100 to 150.
Really?
100 to 150,000. But there is always a payment scheme. So na mga down payment, and you can talk with directly to the company. No? So dili sa amo, no. But directly to come, they have this. They want to help. They want to help. That's why they have that payment scheme. So that's one, no? That's just the brace. So the monitoring will
Katong old nga karaan nga brace, Doc, mas barato
to siya, pero rigid brace man to siya. So mo na nga
So mas effective good and you would much more prefer the new one.
Even if way beyond skeletal maturity. So kung dili na 18 years old, way beyond na, kung 20 plus na, beyond skeletal maturity na. So wala na nagtubo, so dili na kay drastic ang progression of the curve. So they can still have they can still start spine core.
Okay.
To control the pain. There is monitoring. Initially it's once every month, so later every 3 months na, every 6 months. So we have to adjust the tension of the straps. We have to do that. So every time you see for follow-up, you have to have an X-ray before the adjustment and after the adjustment. That needs budget. And another one, there is a professional fee for the doctor. So these are the expenses
that you have to be prepared of.
Not included in the brace price itself.
Now, Doc, let's move on towards the misconceptions about scoliosis. There are also certain questions that I'd like to ask clarifications on. Number one, some people say that you can see a chiropractor to correct the curvature of your spine. Is that myth or is that a fact? Nga a visit to the chiropractor can straighten your spine again?
That's a difficult. No, it's not that it's difficult. It's awkward. Essentially, a chiropractor's claim. I've never gone to a chiropractor, but the way I do understand, chiropractors do claim that they realign the spine by manipulation.
Yeah.
The way I see it is what the intervention or the manipulation of a chiropractor would probably be similar to what you would get from rehab, from stretching. That is perhaps just focus stretching that is being done. I kind of find it weird to do manipulation of the spine because remember, your bones are attached with a lot of ligaments. Even doing surgery, it's not as simple as just opening it and realigning it. There's a lot of detail gone into it that not like faith healing or anything that you just realign it. So I don't know what Dr. Anota would comment as far as a chiropractor being similar to interventions of rehab.
I will just answer that question by sharing to you how I answer that question with my patients.
Yes.
Because you know the patients, they always ask these questions.
They ask
and
you
they are not ashamed to ask me that question because I always answer their question.
What's your common?
I will tell them, if you want to go ahead. But you should not, we taught you certain exercises and that is based on your curve. That is based on science and what we know about the management. So just continue the exercises that we prescribe to you. Continue it because you understand it, how to do it properly. So if you want to go ahead. Basta as long as there is no additional problem, additional pain, additional whatever is there, no, you may go. But I see these patients, they still come to see me after their trip to the chiropractor. But I always tell them not to, I always tell them that I cannot comment on that because I don't know what they're doing.
Okay.
So that's how I answer them.
Number 2 question, Doc. I get this comment a lot, being a scoliotic woman. When I was younger, people would always tell me, and coming from women themselves, they would tell me that, uy, scoliotic ka, di ka magkaanak. That's what they always saying, di kuno ko magkaanak. And then I shared to the viewers a while ago that was one of the reasons why I chose to have children in my 20s because I was scared of that threat that they keep on telling me. So what is the truth behind this, Doc?
Okay. Scoliosis has nothing to do with fertility. Okay, so having a child is from your fertility, so you can get pregnant. But if you have scoliosis, you do need to inform your obstetrician because of, you also have to be prepared in a way because of the mechanics of your back. The fact that you have scoliosis, your risk for back pain is a little higher.
True, and it
You have
happened to
more
me.
back pain, and the mechanics, there is a risk of the scoliosis to progress because
really?
of the weight of your tummy when you do have a baby. So these are things you just have to closely monitor these things. But it's not correct to say na di ka magkaanak because your scoliosis had nothing to do with your fertility.
Thank you so much for clarifying.
And anyway, you proved them wrong already.
Yes. I have 2 kids.
I will add.
Yes, Doc, go ahead.
I will add to that because I have patients who were able to conceive and one child, ganyan. Tapos, and then, of course, your age will progress, no? Gipadako na nimo imong anak, o niya, scoliotic ka, niya, ni-progress na, naada na og 2 years sa imong life. And here comes you have pain already because you were taking care of the child, etc. And you continue to be a mother, etc. No? So I always tell them, you are in the childbearing years. If you want to have another pregnancy, you have to do your homework. Do your homework, meaning do your exercises to prevent pain in your back, anywhere in your back, not only the low back. Okay, so that you are very physically fit when you are pregnant.
Yeah.
Because we cannot give you medicine when you're pregnant.
Yeah. I'll keep that in mind. Do your homework.
Do your homework yun. So if
I
you
have
want
2 toddlers. Mas dali na mo sakit ako.
Yes, because you're older now than before. Yeah,
But I would agree, Doc, when you said about the painful back, because my first child, I went through 20 hours of labor, and it was very excruciating. I had abdominal and back pain. So it could probably have been also, my scoliosis could have played a factor sa akong sakit na likod.
Possibly, and you probably did not do your homework before you got pregnant.
Guilty.
You were not
Wala
doing your
stretching.
exercises, diba? So you were not, in a way, you were not preconditioned to handle it. Because although they can give you pain medications, like your epidural, and it also becomes a little bit difficult sometimes doing that because of the alignment of the spine.
That's true. Sa akong second childbirth, I had an scheduled CS, Mango Doc. And one of the things that I was really scared of was not the operation itself, but it was the spinal anesthesia, because I always tell them, Doc, hiwi ba akong likod? Ma-shot ka na ninyong tarong. And I was really scared of that.
Okay lang yan kasi lumbar spine naman ang spinal. So hindi naman doon yung scoliosis.
Mo lang to, I was really scared about that fact na scoliotic ko, basig dili mo ang tusok sa akong back. But anyway, it was successful.
So if you plan to have another child, you need to first do your exercises.
Yes.
I will do my
Preconditioning.
exercises, but the third child is parang wala na sa plan. Next question, Doc. Is it okay to have a massage in the regular spas that we have here? Okay ra ba? Kanang mga Swedish, shiatsu massage?
Okay. Pre-pandemic, yes, sure. Now, well, with all the precautions,
Yeah.
I think the massage is not really a contraindication. It will not make your scoliosis worse. It will not do anything. It's just, sometimes they would say it became painful after the massage. It depends on how strong, forceful the massage is. Because that might be the muscle spasm that resulted because of the medyo hard massage. Might be misinterpreted as the massage having an effect on the scoliosis.
Sometimes the masseuse has this, they have certain movements nga para gyud for the straight spine people. So for us scoliotics, medyo wala man nasunod akong spine kaya ana ba siya. But it's okay. Okay ra siya.
You know, if you talk about massage, you improve the blood supply to the muscle, thereby relaxing the muscle.
So it's actually good.
Yeah, that's actually good because the pain can be due to muscle spasm. So you're relaxing the muscle, thereby relieving the pain. But do not allow them to stretch you because you have a different set of stretching exercise. So you know you're stretching, go for the massage, do not allow them to stretch. Stretch on your own. That's my advice to my patients.
No shiatsu, just the Swedish.
Yeah, that's just the massage. Enjoy it. Enjoy like to enjoy life.
Thank you, kayo, Doc Judith and Doc Elda. I really learned a lot. I learned along with our viewers about scoliosis and everything that's attached to it. Before we say goodbye, Doc, can we ask for your parting message? If there's anybody out there who's watching this and who feels that he or she may have scoliosis, what should he or she do? Doc, Judith, would you like to start?
So for scoliosis, the best thing there is actually to consult, just to consult, to be evaluated. Don't be scared of going to your friendly orthopedic surgeon. It will not mean that we will all operate on you. You just be evaluated so you know what your options are. Don't wait for it to be too late.
I agree 100%, more than 100%. Go girl, go to your doctor, enjoy life. Even if you have scoliosis, you have a different back, but you can still continue to do the things that you need to do and want to do. Play all the roles that you want to do in your life. Enjoy life.
Thank you so
Do
much.
your homework.
Yes, do your homework and enjoy life at the
Yes,
same time.
yes.
Thank you, Kayo, Doc Judith, Doc Elda.
You're welcome.
And we'd also like to thank our viewers for taking the time to watch this episode. And coming from somebody who's also scoliotic, again, if you are experiencing the symptoms that we've discussed in today's episode, please do not be afraid to seek medical advice, because when you have scoliosis, it's not the end of the world.
Yes.
This has been Andrea Patenio Matthew for Girl Talk.